Welcome back. This segment is brought to you by HRC Medical. Did you know that if your hormones are out of balance, it can make you feel tired, sluggish, experience a loss in your sex drive, and maybe even mood swings? Well, Dr. Dan Hale of HRC Medical says they use natural hormone replacement therapy to treat many of those symptoms. It's good to have you here.
Good to be here.
When you talk hormone replacement therapy, it can be a scary topic because you always hear about those synthetic hormones. This is something different.
That's right. Those are the synthetics made out of horse urine from pregnant mares. It causes breast cancer, cervical cancer, heart disease, blood clots. What we use are bioidentical hormones. That means hormones that are identical to the hormones that you had when you were 20 years old. And that means that they're natural. It means that we're going to not have any of the problems associated with the bad kind. It does not cause any of those things. It cannot cause. As a matter of fact, some studies are even showing that probably are somewhat protective from some of those same things that the synthetic hormones cause.
We talk about things like exhaustion and loss of sex drive. So many of those things, they're all, a lot of it, a natural part of aging, and they can be associated with so many things. Who is a candidate for this hormone replacement therapy, and how does it work?
That's an excellent question. The idea is that those things that you just got through naming off, a lot of people say, well, it's natural for us to go through that. But this is exactly like saying, well, it's natural for you not to see as good as you get older. So you don't need glasses. It's natural for you to not see good.
You don't want us to accept those symptoms. There is a way to eliminate them from our lives.
Exactly right. We want to replace the hormones that you had when you were 20 years old. So some of the main symptoms are tiredness, all the time not resting well at night. A lot of women have that problem. Decreased sex drive, weight gain, especially around the midsection and the butt. Those are the kind of things that people suffer from, and they think that it's just part of life, that it's natural, and you just have to go through it. You don't have to. It can be corrected.
A lot of diagnoses of depression nowadays, and this is something big too, right?
Yeah, so many people are taking antidepressants, and the reason why they go to their doctor and they name off those things I just got through naming to you. So the doctor says, "Oh, here's some Lexapro, or Prozac, and all these different things." You don't have to be on those kind of medications. They actually make the thing worse. When you're taking those medications, you're just masking the symptoms. You're putting like a lid on a kettle, but it's not solving the problem. All those things that you're talking about that's associated with depression are actually the main cause is lack of hormones.
And during the break I was talking to you as if it was just an issue for women, but actually, you know, hormone replacement therapy is viable for men too.
We look at men on television, you see advertised all the time for the Viagra and the Cialis, all those things, and the sex drive. Men also put on the weight. You see the pot bellies. Anytime you see a man walking down the street with a big belly, there's lack of hormones. Anyone that's gaining weight, anyone that's overweight, you check their testosterone level, it's going to be low. When you can correct that, it gives them more energy where they feel like working out, or where they feel like taking a walk and getting some of the weight off. So I'm telling you that men benefit from this as much as women do. Now, women have more symptoms, but men will have the tiredness, not resting well, not having the energy that they used to have, not having the sex drive they used to have. So it's for men too.
Okay, so tell me about treatment. How does it work? And when do results, happen?
The treatment is a tiny little pellet that we embed just under the skin, usually in the upper outer quadrant of the buttocks. Lasts for about 3 to 4 months. So it's not something, a cream that you have to rub on every day and monitor that. So we see our patients every 3 or 4 months. And the results, it depends on which symptoms you're talking about, anywhere from 3 to 5 days, a week to 10 days, depending on which symptom that you're looking at.
And then you just go and get your pellet refreshed.
Exactly.
Is that it?
Every 3 months we draw some blood. And that's another thing. We always are going to be checking the blood. When it's one size doesn't fit all. We're going to tailor every treatment to every single patient according to their symptoms, according to their blood work, and what their desires are. So every 3 months we see them, and we just switch from side to side with the pellets and keeping their blood levels high.
You probably have some unbelievable success stories.
My. It brings tears to my eyes because people come in and say, "This has changed my life. This saved my marriage. I feel better than I have in 20 years." And I hear those kind of things every single day in my practice.
Well, it is fascinating and an alternative that you should check out. You can find more information on this topic on our website. You can actually watch this segment again a little later on WWZM13.com under Take 5 videos. Thank you so much for being here with us. Well, we're wobbling around a little next on Take 5. We're going to jazz up your Jell-O. You like Jell-O jigglers? We're going to make them next. Stick around.